Does alcohol cause inflammation in your colon? Have you ever wondered how alcohol affects your colon health? Let's dive into the details. Research indicates that alcohol consumption can indeed contribute to inflammation in the colon. This happens mainly because alcohol disrupts the intestinal barrier, which is crucial for maintaining gut health. When you drink alcohol, it can damage the cells lining your intestines. This damage can lead to increased intestinal permeability, meaning harmful substances can sneak into your bloodstream more easily. When these substances enter the bloodstream, they can trigger your immune system, leading to inflammation. Specific pro-inflammatory mediators, like tumor necrosis factor alpha and interleukins, are activated during this process. This can be particularly concerning for individuals with inflammatory bowel diseases, such as Crohn's disease or ulcerative colitis, as alcohol can worsen their symptoms and increase the likelihood of flare-ups. While alcohol doesn't appear to cause new cases of inflammatory bowel disease, heavy drinking is associated with worse outcomes for those already diagnosed. Interestingly, moderate alcohol consumption might have a less clear impact. Some studies suggest that certain types of alcoholic beverages, like red wine, could have mild anti-inflammatory effects. However, these findings are not definitive and do not outweigh the risks associated with alcohol disrupting the gut barrier. Now, let's talk about colon cancer. Chronic inflammation is a known risk factor for developing colorectal cancer. Since alcohol can promote inflammation in the colon, it may indirectly increase the risk of colon cancer over time. Additionally, when alcohol is metabolized, it produces toxic compounds that can damage DNA, further promoting cancer development in the colon. For those concerned about colon health or managing conditions like inflammatory bowel disease, it is wise to be cautious with alcohol. Limiting or avoiding heavy drinking is generally recommended to help reduce inflammation and support the integrity of the intestinal barrier. Healthcare professionals often advise limiting alcohol intake as part of a broader strategy to maintain colon health and lower the risk of colon cancer. In summary, alcohol can indeed cause inflammation in the colon by damaging the intestinal barrier and activating the immune system. This effect can worsen symptoms for those with existing inflammatory conditions and may contribute to an increased risk of colorectal cancer over time. If you have concerns about how alcohol might affect your colon health, consulting a healthcare provider is always a good idea.